Hi, my name is Dr. Ryan Green. I'm the medical director here at Legacy Vein Clinic. I want to thank you for choosing Legacy Vein Clinic. I'd like to start by giving you an introduction to venous disease and a little bit of the background regarding varicose veins and venous insufficiency. So, varicose veins affect about 20% of the population. So, 1 in 5 people, about 40% of the population, or 2 in 5, will have what are called hidden varicose veins or venous incompetence. So many suffer silently, unnecessarily with symptoms such as heaviness, achiness, tiredness, night cramps, and swelling. These symptoms can be treatable if they are related to vein disease. So, let's explore a little bit of where varicose veins come from and what venous insufficiency is. First, let's start with some anatomy. Our veins can be split into two categories. We have deep veins and we have superficial veins. The deep veins act as 4-lane highways to efficiently return blood back from our feet to our heart. And then we have superficial veins which connect to the deep veins via channels called perforators or at certain junction points. And the superficial veins act to drain the skin and subcutaneous tissues, the blood that returns from there. And they're the ones that we'll be talking about and dealing with as we move on in this talk. So, venous disease has a lot to do with gravity. So, as Homo sapiens, we walk upright, and gravity wants to push blood back down to our feet. When we lie down, the effect of gravity is minimized and the blood returns easily back to the heart. However, again, when we stand up, gravity forces the blood down to our feet, so we need a way of getting that blood back returned to the heart. And one way we can do that is the set of muscles in our calf which surround the veins and act as a sort of calf pump, so to speak. So the calf squeezes, then in turn squeezes the venous blood back upwards, and then it's caught by a series of valves. So we have one-way valves going from our ankle back to our heart, which catch the blood and do not allow it to go backwards and only allow it to go forwards back to our heart. So that the combination of our calf pump and our valves function to effectively circulate our blood. And so over time, for many reasons, valves can fail in the veins. Some of the reasons include obesity or hereditary causes, hormone exposure in women. Progesterone is a relaxing hormone. It allows the veins to relax and allows the valve leaflets to come apart from one another and therefore not function properly. In addition, it can be related to your job. Jobs that require prolonged standing or sitting, such as factory work, beauticians, hospital workers, people that stand for prolonged periods of time, and other jobs where you sit for prolonged periods of time. This allows the blood to cause undue stress on the veins and the valve leaflets to come apart, and then the blood begins to reflux. So reflux is the wrong way flow of blood. It's a top-down phenomenon. So reflux, when we talk about the superficial system, it begins where the superficial meets the deep system, or the junction. So we have a few of these junctions. One is up at the groin. That's the junction of the great saphenous vein. And then we have one behind the knee, which is the junction of the small saphenous vein. So that blood then goes backwards, and the valves become leaky or incompetent for those reasons we discussed previously, and then it causes several problems. So if there are little side branches in the superficial veins, those side branches now see an increase in pressure and begin to dilate, and there is turbulence of the blood, and so that causes the veins to become varicose or dilated. In addition, if the blood starts to go backwards, it can leak out fluid, and it sets off a cascade of inflammation in the subcutaneous tissues surrounding the vein. So that can cause swelling, can cause skin discoloration, redness, or brown discoloration. Brown is actually pigmentation from iron that's in the blood. And then ultimately, if the pressure is so great and the inflammation is such that the skin begins to break down, you can get skin ulcerations, which can be painful and very difficult to treat. So that's venous disease involving the legs. Venous disease affects more than just the legs. The same phenomenon, this top-down venous reflux involving incompetence of the valves, happens in other places. So, for example, in men, when the gonadal vein becomes incompetent or the valves don't function, the blood can back up and give rise to dilated veins in the scrotum, which is known as a varicocele, or some may know it as a bag of worms. In females, it's the same idea. The same ovarian or slash gonadal vein can become incompetent and cause backup into the pelvic veins. And so these pelvic veins become very dilated and can cause significant symptoms, pelvic pain, heaviness, and pain during intercourse. And if the blood backs up into the veins that supply the labia in women, it can cause vulvar varicosities. Again, from the backup of blood up in the pelvis, the vulvar varicosities can stick out and cause pain and be very uncomfortable. So each of these conditions can be treated by one of our physicians. If these symptoms sound familiar to you, please mention them to the physician doing your consult, as we have the ability to treat them. We can navigate through the veins using image-guided procedures, which are minimally invasive, and shut down the abnormal veins, and can significantly improve your quality of life. So a bit about us. So we are both interventional radiologists and we have a vascular surgeon as well. We are board certified physicians who are trained in image-guided procedures, minimally invasive techniques to treat venous disease. So we're trained to manage not only the more outpatient superficial venous disease, but also disorders of the deep veins. We're skilled at techniques which require image guidance to either close down abnormal veins or open up blocked veins. We also have 2 diplomats of the American Board of Venous and Lymphatic Medicine, whose stated purpose is to improve patient care by having physicians prove their knowledge and expertise in treating venous disease through a standardized curriculum and passage of a rigorous certification exam. So the bottom line is, if you have venous disease, you've come to the right place. So as physicians, we definitely don't do this alone. We've assembled a fantastic team at Legacy. We have a very friendly front office staff. We have vascular ultrasound technologists who will do your pre and post procedure ultrasounds and with whom you'll spend quite a bit of time. We have a procedure technologist who also does sclerotherapy. We also have a billing coordinator who can assist in getting procedures approved with your insurance and helping you navigate the increasingly difficult world of insurance. So our whole team is here to help guide you through the process of getting your veins evaluated and ultimately looking and feeling better. So thank you very much for choosing Legacy Vein Clinic.